to parasites and the diseases they cause. Schistosoma, starting with schistosoma, we have 5 species worldwide of schistosoma. Now, schistosoma haematobium will be considered with the UGS, urogenital system. But regarding the Mansoni, today we will discuss it because it is related to the GI module. Schistosoma japonicum, mainly in Japan, locally not important, is the most infectious. It is intestinal schistosomiasis again, but we are not going to cover it because we are covering Schistosoma mansoni. Intercalatum and Mekongi of limited importance. So our lecture regarding Schistosoma mansoni. Schistosoma adult worm, this is the Schistosoma adult worms, male and female. They inhabit the portal vascular system. You know the portal system in the body. And these schistosoma have got ventral and oral ventricles. These are the ventral suckers and oral suckers for attachment. And they have got cylindrical bodies, although they are trematode. But these trematode have got schist groove in the male to carry the female in it. This one here. So the female is longer than the male and cylinder, rafi'a. The male is about 1 to 2 centimeter with deep schist. شو معنات schist? Groove, شق, to carry the female in it. In the ventral, it's called ventral groove, to carry the female, which is cylinder. Schistosoma considered as trematode. You remember the worms, we have classified them into nematode, cystode, and trematode. The life cycle, male and female are mating in the hepatoportal circulation, and then Schistosoma mansoni travel to the inferior mesenteric system around the descending colon and rectum. That is why we are studying Schistosoma mansoni with the GI module. The eggs of schistosoma are deposited in the submucosa. By the way, Schistosoma haematobium will harbor or will be present around the bladder, and we will talk about it in the UGS system. Eggs are deposited in the submucosa, then go to the intestine, and then out with the stool. Outside the body, they hatch and release what is called miracidia, the single one, miracidium. Now, the miracidia go to a snail and stay in the snail for 1 to 2 months. تبقى بالسنيل 1 to 2 months, and then become cercaria. Cercaria characterized by forked tail, يعني الذيل تبعها مشطور. This cercaria can penetrate human skin, and after penetration they become schistosomiola and losing the tail, and from there go to the vascular system, first of all to the right heart, to the lung, and then to the left heart, then to the liver hepatoportal system. And we will see this in the figure. you can see that the eggs are past. Schistosoma, haematobium, this is the yellow one. And Schistosoma japonicum is on the left side, and Schistosoma mansoni, which has lateral spike, janibi, spike, janibi, bruise, janibi. The eggs hatch and release miracidia. These are the miracidia. They go inside the snails, okay, and stay 1 to 2 months here, and then emerge as cercaria. Cercaria has got forked tail, ذيل مشطور. These have the ability or capability of penetrating human skin if walking barefooted, and once they enter into the body, they lose the tail and become schistosomiola. These schistosomiola migrate to the right heart, then to the lungs, and then to the left heart, to the circulation, and larvae mature into adult in the liver, and adult worm mate, and produce the cycle again. So Schistosoma mansoni and japonicum migrate to the mesenteric vessels and shed eggs into the stool, and then they come out the body and repeat the cycle again and again. Epidemiology of schistosomiasis is the most important helminthic infection. In 2017, more than 200 million cases of Schistosoma mansoni worldwide. However, the modern sanitation breaks the life cycle. This disease occurs in farmers who works in their farm, where snails are present in water barefooted. يعني الفلاحين بيشتغلوا barefooted. So there is a chance to get the schistosomiasis. Schistosomiasis is the disease. So it has certain geographical distribution. The most important country, for example, in schistosomiasis, where it is distributed more than other countries, is Egypt, for example. The peak of schistosomiasis in the second decade of life. Why second decade of life? Because these are the working people, people who work in farm. Pathogenesis, first of all, penetration and migration. We said cercaria penetrate the skin and then become schistosomiola, and this migrate as we have seen in the body. Once they become adult, the female lay eggs, ovi, and these eggs characterized by lateral spine or spike. And some of these eggs, just 1 minute, please. Okay, so the ovideposition called, or oviposition, the female lays eggs in numerous numbers. Some of them get out of the body, some of them retained, تنحصر inside tissues, and granuloma will be formed around these eggs. so granuloma formation. We will talk about these points one by one. Immunity, cell-mediated immunity to the retained egg. يعني الأجز المحصورة بالجسم. Of course, egg, large egg. أكيد cell-mediated immunity. And the role of T suppressor cells or suppressor T cells, which are called Treg. You know Treg, T regulatory cells, which play the role of suppression of the immune system. Also blocking antibodies of IgG4 subclass. And again, the cell-mediated immunity depend on the HLA of the body. HLA A1 and B5 are more prone to get reaction against these retained X. The body gradually, because of these retained X, will be present for a long time. The body gets immunological tolerance. The body gets immunological tolerance to the parasite. يعني ما يعمل immune response, tolerance, no immune response. Now, also there is concomitant, accompanied immunity, which is due to a protective specific IgE. And I said in the lecture, the previous lecture, that IgE is very important antibody in protection against parasites. A clinical aspect of schistosomiasis in the early stages, when there is penetration of the skin by cercaria and then become schistosomiola, there will be intense pruritic skin rash, حكة شديدة, due to the penetration of the skin. This is type 1 and type 2 hypersensitivity, which can occur within 24 hours. In 1 to 2 weeks, general symptoms could appear in the body. So we enter into the intermediate stage. Oviposition. The female lays eggs, and these eggs have got antigen, and the body produces antibodies against them, so you will end up with immune complexes formation in the form of serum sickness type 3 hypersensitivity. تعرفوا الهايبر type 3 hypersensitivity is due to immune complexes. You know this from your immunology course. In 1 to 2 months, the patient develop these immune complexes. Then the patient develop a syndrome which is called Katayama syndrome, in which there will be an increase in white BC, white blood corpuscles, eosinophils, IgG, IgM, and IgA. This is called Katayama syndrome. In Katayama syndrome, the patient will suffer from fever, urticarial, rash, طفح جلدي, enlarged liver, hepatomegaly, and enlarged spleen, splenomegaly, and bronchospasm, تضيق في القصبات الهوائية وضيق نفس, dyspnea. Then the patient passes into the chronic stage. There is inflammatory and fibrotic reactions to retained X. So the X will be surrounded by inflammatory cells and fibrosis around them to contain them. لاحتوائهم. Liver and spleen involvement, as I said, cell-mediated immunity is related to the HLA. Hepatitis B and C superinfection can lead to chronic active hepatitis. This is one point you have to remember it. If you get schistosomiasis, an inflammatory condition in a chronic stage, it may lead to chronic active hepatitis. You have to remember that schistosomiasis occur in the portal hepatic system. Diagnosis, you have to detect the eggs in the stool. Sometimes you need concentration method may be required just to make the yield of stool examination better when you do concentration. Local biopsy from the tissues which you suspect that eggs are retained. And also we can do what is called egg viability tests that are passed in the stool. Not all eggs are live and viable. Some of them are dead, which are not important. So you have to know the percentage of the eggs which are viable. Again, we can use enzyme immunoassay of the antigens which are present in the blood due to schistosoma. التريتمنت in case of dermatitis حكينا بيصير dermatitis, يصير urticaria, يصير rash. So this is dermatitis. And Katayama fever, you give antihistamine and corticosteroid to suppress the immune response, to inhibit the immune response. Anti-helminthic drug, praziquantel is the agent of choice, oral single dose. And I have mentioned to you previously praziquantel. Alternative to praziquantel, a drug called artemisinin. This is alternative to praziquantel and may be used for the resistant cases. Prevention of schistosomiasis. Sanitary disposal of feces. We have to educate people not to defecate in farms, in water supplies, and to use molluscicides, يعني قاتل القواقع. Molluscicides effective in preventing the miracidia going to the snails. And also in China, they have applied a program which is multi-pronged program, multi-prolonged program, يعني program, multi-prolonged program, which is for a long time. The aim of it is just to prevent the cycle of the life cycle of schistosomiasis. We have reports that this program is successful and effective in the prevention of schistosomiasis. Vaccine is under development. Until now, there is no vaccine, but it is under development. We finish with schistosomiasis and schistosoma mansoni. Now we come to another parasite, which is called echinococcosis. What is echinococcosis? Hydatid disease. الأكياس المائية، يتكون بالجسم أكياس مائية تحوي هذا الباراسايت. راح نتكلم عليها ونشوف كيف تتكون. So, tissue infection of a human being is by larvae. So, the larvae enters into the human body, and these are called Echinococcus granulosus. There is another one called Echinococcus multilocularis, locally not important. So our talk about this worm, Echinococcus granulosus, which is a tapeworm, شريطية, cystod. The adult worm of Echinococcus granulosus live in the small intestine of canines, like dogs. These Echinococcus granulosus tapeworm have scolex. Scolex معناتها head, الرأس, which has 4 sucking discs and double hooklets to attach. So it has 4 sucking discs and double hooklets. عروات زي العروة for attachment. The adult is quite small, 5 millimeter long, and it has 3 proglottids. حكينا البروغلوتيدز قطع الديدان، يعني هذه قطعة. This Echinococcus granulosus has got 3 proglottids, immature one, mature, and gravid, which contains the eggs. So you can see the suckers and the hooks, then the neck. Then we have a 3 segment, immature, mature, and gravid. This is the Echinococcus granulosus. The life cycle. Eggs are ingested by intermediate host. يعني intermediate host like sheep, goat, and sometimes a human being. You know, these eggs are distributed by dogs in the farm around the living area. And these intermediate hosts do not have adult worms. They ingest the eggs. And these eggs, once they go to the intestine, they hatch and produce larvae. The larvae here are called oncospheres. يعني من واحد يسمع oncospheres معناتها larvae، اليرقات. This comes from the eggs that hatch in the intestine and then penetrate to the portal system, to the liver, and then to the lungs, then to the systemic circulation, and can be distributed everywhere in the body, in the brain, in the bones, kidneys, other tissues, and these larvae will form what is called cyst. هذه اللي نسميها الأكياس المائية. hydatid cyst. فإذا intermediate host like sheep or goat, sometimes a human being. A human being can be considered as intermediate host. You should pay attention to this point. A human is intermediate host. أجلكم الله, like sheep, goat, and others. Cysts are formed. إذا بس تسمح لي أكمل وأنت اسأل. لا، في بعض الأونكوسفير تستعمل مع بعض الباراسايت. واحد منهم الإيكاينوكوكس. ممكن استعمالها مع كثير من الباراسايت الأخرى. بس الأونكوسفير هون معناتها العربي. نعم. السيست it has external laminated cuticle. جدار صلب خارجي. external laminated cuticle. وراح أشوفكم هذا الجدار بعد removal of the cyst by surgery, and you can see the external laminated cuticle, how hard is it. And also it has internal germinal membrane. And I will tell you what will be the function of the internal germinal membrane. So it has external wall and internal germinal membrane. The cyst enlarge gradually and start to form daughter cysts. From where? From the internal germinal membrane. يعني هذا الانترنال germinal membrane راح يولد لنا daughter cyst, which going to produce a new protoscolosis. وبروتو يعني شبيهة بالسكولوسيس اللي راح تصير بعدين سكولوسيس الهيد مال الايكاينوكوكس granulosus. So produce a protoscolosis from their germinal layer. This is germinal lining. Sometimes these protoscolosis, we will see it in a picture in a moment, sometimes detached to form what is called hydatid sand in the cyst. تسقط يعني it contains fluid, so it will drop inside the fluid. So you can see this is the external hard layer of the cyst, and this is the germinal layer. Okay, and from the germinal layer you get the daughter cyst. This is the daughter cyst. It contains what? A protoscolysis, protoscolysis. Now these cysts are present everywhere in the intermediate host. يعني مين هم الانترميديت host؟ dogs, sheep وgoat إلى آخره. فأنتم بالمناطق القروية أو at slaughter houses في المسالخ تبع الذبح, there are dogs around the area. If any animal like sheep and goat died, usually the farmers throw these dead animals, throw them away. The dogs come and eat these animals. So they get the protoscolysis, okay, from eating the contaminated tissues of the infected animal. So ingestion by definite host, اللي هم منه definite host, الcanine like dog. Protoscolysis will evaginate, يعني تخرج إلى الخارج, evaginate. هاي الصورة ما موجودة عندكم بس واضحة. evaginate يعني يطلع الرأس تبعها to develop scolysis, يعني رأس الworm, which is going to attach to the intestine by their sucker disc and hooklets, and تعمل attachment by the sucking disc and hooklet. Then they develop into adult worm in about 1 to 3 months in the small intestine, and the cycle will be repeated again. راح نشوفها الآن in this figure. Eggs are produced in the feces of dogs, of course, all right? Oncosphere hatch and penetrate the small intestine if in the intermediate host these eggs will be ingested by intermediate host. مين هم الانترميديت host؟ sheep وgoat وسواين وبعد مين؟ الهيومن بينج. تذكروا نقطة مهمة جدا هون أن الهيومن بينج intermediate host. أجلكم الله حال بقية الانيمالز اللي حكينا عليها, sheep وgoat وسواين. So once these eggs are ingested, oncosphere hatch and penetrate the intestinal wall and will be distributed everywhere in the body, to the liver, to the lung, to the brain, every tissue. Now, once these animals like sheep or goats died for a reason or another, they will be eaten by dogs or other canine. And these sheep, for example, or goat, got the cyst inside their tissues, which contain the protoscolysis in the cyst. So they are going to ingest the protoscolysis. The scolex will attach to the intestine and form the mature worm, which is going to repeat the cycle again and again. This is explanation to what I have said. You can read it. There is nothing more than what I have said. The less important types Echinococcus multilocularis ما مطلوبة من عندكم. You can see echinococcosis. This is the area where we have seen the cyst. Echinococcus cyst in the lung and the white lining membrane. This is, you can see it. How hard is it? And these are the protoscolices inside the cyst, called the protoscolices. هذا هو التيبيكال cyst. شوف outside cuticle, outside wall cover, hard cover. This is the egg of Echinococcus, which has 6 hooklets inside them. These are the protoscolices released from the hydatid cyst. Epidemiology, pastoral infection. Pastoral معناته الرعاة في المراعي اللي يرعوا الأغنام والجوت إلى آخره. فpastoral معناته الرعي. Maintained by allowing dogs to feed on what? On sheep viscera. Sheep viscera contain a cyst, intermediate host. A human infection can occur hand to mouth with the contaminated, when contaminated with the eggs. Infection via eggs after dog contact. ودائما الفارمرز بيحووا الدوجز أيضا. فالدوجز pass a stool and the stool containing eggs, human being may get the eggs from there. And there is another cycle which is called sylvatic infection, البرية في البراري, outside towns. This is locally not important. A clinical manifestation, تعرفوا انتوا راح يصير عندنا cyst في مكانات مختلفة من الجسم, بالليفر, باللنك, بالبرين. This cyst has mechanical pressure, يعني يعمل pressure, ضغط على الأورجن. So mechanical effect after many years. Usually asymptomatic. Pastoral, in pastoral type of spread, hepatic cyst seen in 60% of the cases. Sometimes if the hydatid cyst rupture inside the body, for example, during operation, surgical operation, it will lead to anaphylactic shock. So surgeons are always know not to rupture the cyst. And you may get sometimes a specific organ manifestation. If it is present in the liver, the manifestation will be different from when the cyst is present in the brain. In the brain, they may lead to epilepsy, الصرع. Diagnosis of a human echinococcosis, radiological and scanning, ultrasound. تعرفون انتو شو معنات الالتراساوند. Sometimes we can do diagnostic and therapeutic aspirate. With needle, long needle, you can aspirate some of the fluid for diagnosis and for therapy, just to decrease the pressure. Serological diagnosis, that is to say, to detect antibodies against Echinococcus granulosus, positive in 90% of hepatic cases and 60% in pulmonary cases. So the serological diagnosis, very useful in hepatic hydatid cyst. PCR also very sensitive. The treatment and prevention, surgical for selected cases. سابقا كانت الجراحة أكثر. بس اليوم في بدائل للجراحة. So it is only selected for special cases. We can use an infusion of a scolicide agent just to kill the protoscolosis. We use 20% hypertonic saline, which is highly concentrated, plus 95% ethanol. And there is a special technique how to give it. ما مطلوبة من عندكم بس اتذكر 20% hypertonic saline plus 95% ethanol. You can use concomitant albendazole for several weeks or can be extended even to years, 1 to 2 years, 3 years, albendazole. Hygienic measures for prevention, hand washing, deworming of dogs, especially when people harbor them, offal, الفضلات, offal,